All right. Aloha. Aloha again. It is the traveling doctor, Dr. Albert Lin. Um, this is the April 2nd, 2020 podcast for COVID-19. So this is the first time, a couple of things. First time I'm doing this on Instagram Live. And I'm actually trying to record this for a podcast too. For all of you who haven't been with me before, this is my daily twice a week COVID-19 podcast, okay? So I'm gonna bring you all the new updates on drugs, tests, PPE, a lot of those things. And take some questions too. So hopefully I can answer a couple of those. Yeah. So hopefully that works. So for a lot of you, know that you are been caught up to date with my stuff. In case you miss some of this, it's going to be in my YouTube channel, which is later. And I am trying to do this on, again, Facebook Live. So you can find me at the Traveling Doctor or the Traveling DR. On Instagram, my new account will be the traveling_MD. You could look for me on YouTube, just the Traveling Doctor. And again, I'll be doing this on Instagram Live over here for now. So this is day number 20. I've done 20 days of social distancing. And I've been officially not sick and had a negative test for something like 17 days, or no, sorry, 10 days since last Friday or last Sunday. So that's kind of where I want to go with this from now. I'm gonna go over a couple of things today. So first of all, I kind of want to go over a little bit about symptoms, because I think there's a lot of confusion on symptoms. I'm getting a lot of questions about what kind of symptoms happen, blah, blah, blah. Basically the number one symptom that usually happens is fever, okay? So fever, it's about 75% are hospitalized with fever, but actually 50% of those don't have any fever at all once they are admitted to the hospital. That's just of the sick patients, okay? So everyone's like, do I have fever? Do I have cough? I have fever, cough, this, that, whatever. Do I have COVID-19? I can't tell you that. Only the test can tell you, okay? But fever is generally a more common symptom. Hacking cough, especially dry hacking cough, it's about 60 to 80% of the time you're gonna get stuff like that. Now, I've heard a lot of other things. There are things like, some people are complaining about red eyes and diarrhea, GI symptoms, stuff like that. A lot of that's anecdotal. That's stories from nurses, doctors. It's a little bit different, than flu and allergies, I would say. But generally, I can't say that that's a common symptom. For example, GI symptoms, they find that in less than 10% of COVID-19 cases. The other stuff like headaches, sore throat, sniffling, a lot of stuff with the flu and allergies, you're not going to get that much in basically a COVID-19. So going on from that, I'll talk about a couple of other findings. They're going to have chest X-ray and CT scan findings. Those are actually a pretty good indicator, but for obvious reasons, you can't test everyone with a chest X-ray or CT scan. For example, chest X-ray findings of bilateral pneumonia, a lot of times you have that in about 60, 77% of the cases, from the mild to the sick cases. CT scans, 86 to 95% of the time you get CT scan findings. But again, these are hard to do for everyone. And again, if you're sick, you're gonna have to decontaminate and wipe down these places, the X-rays, the CT scans all the time. So it's a little bit more difficult. Again, I normally doing these podcasts 4 p.m. Hawaii Standard Time, but I'm sort of backing it to 1 p.m. to make it better for East Coast people, West Coast people, okay? So some other things you're gonna find, white blood cell count generally on tests is a little normal. Lymphocytes and platelets are decreased, but these are all sort of generally non-specific findings. Other lab tests, increased LFTs or liver tests, D-dimer, lactate dehydrogenase, CRP, erythrocyte segmentation rate, troponins. A lot of these things are generally elevated, but these are really non-specific. Hey, what's up, Marissa? Hey, Jameson, and a bunch of other people joining in right now. I'm seeing everyone come in. So this is from Facebook, and again, first time I'm doing Instagram Live and podcast. So this will be on everything later. It's getting more popular. One other thing they're finding, again, and this is a technical term, the R naught. The R naught of COVID-19 is 2.2. That's not that high. That generally means that this infection gets spread on general to like 2.2 people. To put it in perspective, you ever watched that movie Contagion with the really bad kind of flu that went on there? That was 4 to 5%, so that was much worse. What's up, Amanda? Aloha. Welcome to the show. And Valeria, welcome to the Instagram Live and Facebook podcast. Generally, I'm doing these are running 60 and 90 minutes. I was worried that this is too long for people, but a lot of stuff. So here's an update about tests. A lot of people are asking about the tests going on. Again, the normal test is nasopharyngeal test, the one that goes all the way up your nose. They wiggle it around and they test for it. And as a lot of you guys know, those are kind of bad tests. There's 30% false negatives, meaning that 30% of the time when you get a negative test, they're not so good. That's still better than the oropharyngeal test. And the oropharyngeal test is a lot worse. Oropharyngeal test, by the way, that's the one it seems they're using a lot in California. My friend in San Diego, my friend Brian, has got an oropharyngeal test where they make you kind of breathe in and cough out and do stuff like that and then swab your mouth, not your nose. I think that's a really bad test. And my friend has been waiting 12 days for that. My friend Brian's been waiting 12 days. Other people who got tested with the nasopharyngeal test a week later have gotten their test results back. We have some free nasopharyngeal tests in Hawaii. Those are all better. And so California is really behind. The California testing numbers are really low. There's a big backlog. They're one of the states that's doing the worst in terms of tests, but better overall for numbers. But that's probably just because they have fewer tests that have been done, and a ton of them are, again, backlogged. Same thing with Texas. The states that are doing really well are so a lot of people are joining in now. A lot of the states that are doing well are states like New York and Washington, Louisiana, even Hawaii, on some level. So I'll go into that. So again, the oropharyngeal tests are a lot worse than the nasopharyngeal tests, where they stick it up your nose. That's where they're doing it in most of the countries, actually. Another thing I found out, the oropharyngeal tests are being prioritized lower, meaning they're trying to clear all the nasopharyngeal tests first, and then they're going to do the oropharyngeal test. So that's probably why my California friends are waiting a long, long time for their test results if they're doing oropharyngeal, because the nasopharyngeal ones are being done first. So another update, again, you've heard about all these quick tests that are coming out. I talked about a couple of them in my last podcast. Abbott Laboratories is an FDA-approved 5 to 15-minute, again, point-of-care nasopharyngeal test where they do it right there. But I don't think they're being distributed fast enough, and I haven't heard of any hospitals getting them. They're probably going to hot zones like New York, probably, again, like Seattle, New Jersey, Louisiana. They're going there first. But what they're finding is a lot of the hospitals and physicians are doing the tests that they're used to. So they're not getting these fast tests in. Not the tests that a lot of other countries are using. And again, they differ by country, and there's so much variability. The FDA has sort of not approved, but given emergency authorization for a lot of laboratories to get any test going, but they're still not technically FDA approved. So you can imagine the variability, the way they work, the way they're done is very different. And I'm not even sure about the sensitivity of a lot of these tests, including the Abbott one. And then the new one is, again, the sort of fun one that people are looking at is the Henry Schein test, Schein, Henry Schein. They're publicly traded. They're doing an IgM, IgG antibody test. Again, it's not FDA approved, it's authorized. I want that to be, it's like a very simple test. You like prick your finger like you're getting your sugar for any diabetic, or if you've seen a diabetic get their sugar, and then they put it on like a pregnancy stick. And you can tell you have IgM, which means that you've had the infection, IgG, that means you've made the antibodies, or both, which means you had the infection, you made the antibodies, and technically you're maybe immune. No one has just IgM antibodies. Again, those are the two main antibodies that we look at for antibody tests. IgM alone would only happen when you get the vaccine. The vaccine does not exist yet. And the vaccine, despite what you heard, it's not coming this year. The vaccine is not going to come until, I think, February, or sorry, next year, 12 to 18 months. In fact, I don't think it's going to be really ready for everybody until like May. Double OJ Jameson asks, which is a test the hotels are offering? From my understanding, the hotels are mainly offering the nasopharyngeal test. That's the main sort of, I guess, standard of care right now, so do a nasopharyngeal test. So none of these fast tests are available, at least in Hawaii right now. So you're still waiting. But in Hawaii, for example, it's much better. The turnaround time is getting to about 2 days. They're doing it locally at Diagnostic Lab Services instead of Quest on the mainland. So before, when I got my test, it took me 4 days, right? Now it's only taking 1 to 2 days. But they're still totally checking people in Hawaii, and I'll get to that later. There's another company called Battelle, B-A-T-E-L-L-E, and they're doing 5-hour tests, and it allows people to do it like 200 a day, but 200 a day is nothing. I'll get to why. Again, right now, they're saying in the US that we're able to do 100,000 tests a day. Now that sounds great, 100,000 tests, right? But it doesn't add up for the numbers. How many people exist? How many people are in, state of America? Something like 370 million people, I think. So even if you did 100,000 tests a day, every day for a month, how much is that? That's only 3 million tests, right? So am I doing those numbers right? Yeah, so 10 days would be 1 million and 30 days would be 3 million. 3 million only represents 1% of America. That's nothing the way this, is spreading. We really need 1 million tests a day. Because after 1 month, then we'd have 30 million. That'd be like 10% of America. Or, well, less than 10%, but at least a lot better. Right now, we're not testing anyone. That's why the government is trying to get everyone to get these tests done. And these tests are not being done fast enough and in enough quantities. And we were really behind the ball because the FDA messed up and they didn't do this earlier. And the CDC messed up and didn't accept some tests from other countries that they should have accepted tests from places like, I think, Germany offer them tests, and I think even the World Health Organization. And the CDC has messed up for a bunch of other reasons. So again, we need more tests. Now there's a big sort of debate on the home test. There's a bunch of companies, Nurx, N-U-R-X, COVID, COVID, Everlywell, Carbon Health. A lot of these were doing home tests. Now these tests are great, would be great if they would be considered to be available, but guess what? They're all on hold right now by the FDA. And the reason is I think there's a lot of question about whether these tests are accurate and how you're going to test for these at home. Now, again, if home test means what? A home test means you do it to yourself, or a person like your wife or a friend or your kid or your lover or somebody does it to you. And if they're not doing it right, for example, if it's a nose swab test, now this is not like 23andMe where you spit in a tube. If it was like that, then maybe, it could be more accurate. But when you're telling people they got to swab their own noses and do other things, I think there's a question. So my understanding was they're going to try to distribute them to physicians and everyone. And now my understanding is they're not really distributing them. It's hard to get them either as a local physician or definitely not for private use. So the home testing front for the US is on hold right now. I think we're left with these faster tests, especially like the Abbott 5 to 15 minute nasopharyngeal test, the Henry Schein IgM IgG test, at least in America. Again, every other country is doing a different version of it. I will go on to some of those versions when I talk about the different countries. So that's about the tests. The FDA was worried that they're diverting funds and resources to getting these tests out, and these tests were not that good. I mean, yeah, it's great if you get these tests out, but if they have a high false negative rate, which is what I worry about more, that they don't catch the positive test, or especially a high false positive rate, which I wouldn't think is a problem as much as false negative rate. Again, you're negative and you really should be positive and you really have the disease. The FDA is worried about that. So I don't, unfortunately, I kind of agree with the FDA on this, but the FDA messed up. They should have been letting companies and labs design their tests way ahead of time, because all the tests they distributed in February in US were faulty and screwed up. And that's why it took so long to test. So we lost an entire month of February. And that's the FDA's fault. And some level, you can't blame it the government and Trump, whatever, but you can blame it on the FDA. So again, a lot of doctors are saying that we're not getting these tests out fast enough. I think they did some surveys, said like 73% of doctors are saying that you can't test fast enough, including me. I mean, lately, I think you can get tests fast enough for hospitalized and sicker patients and healthcare workers and people who came in from like, Wuhan, China, or like more like Italy now and Spain and places like that. You can get that 1 and 2 day turnaround again, like I said. It's better right now. So, I want to mention some other tips. Again, I mentioned generally, like for people out there, what should they be doing? A lot of people are asking what they should be doing right now. And I think, again, you shouldn't be hoarding shopping supplies. I'm sure you've seen all these still shopping cart images of seniors out at senior hours at Walmart, Sam's Club, Costco, and they're massive lines. This makes no sense, and people are bringing their families and doing things. I think if you're going to go out shopping, dedicate one person, the same person, to shop. Dedicate them to shop for multiple people, ideally, maybe multiple families. I think you should avoid all large areas, all gyms, all markets. Minimize takeout. And I know a lot of countries are banning this already. For example, New Zealand, my friend Danielle from New Zealand mentioned that they're not even allowing takeout in restaurants there. Now that's pretty strict because in the US, they're still allowing takeout. I think, as I said, you should cancel all elective procedures which are already so dentists, mammograms, colonoscopies, some stuff like this should all be canceled, I think, because these are not, plastic surgeries and all this stuff. So actually a lot of doctors are not working right now. And I think they should be at least canceled for a month or so while we try to get this under control. You need to cancel Easter and Easter services. I've talked about this a lot. Some of you may see my April Fool's joke where I put up like a picture of the Last Supper with cops writing tickets. My point is you should celebrate this holiday. It's a big holiday. Passover is coming up for, the Jewish faith. These are all big holidays. You need to celebrate them, but do it with your family. You don't need to leave, or ideally, pastors are not having big mega church services where 1,000 people. This is a horrible idea. That's the next spring break problem. That's the next travel problem. It's going to be Easter and Passover that I'm really, really worried about. So smaller markets, go to the smaller markets, do smaller religious services, don't go outside. Another thing a lot of people ask me about is the 23 to 27 foot spread. Everyone has forwarded me this thing. Everyone's like, oh my God, like you can get it from 23 to 27 feet away. And if you looked at Dr. What's his name? The CDC guy, the immunologist, I forgot his name already. He demonstrated that this is sort of a kind of a clickbait thing, There's a debate about whether this is airborne versus droplet, COVID-19. And this is the problem. I think your typical lay person doesn't understand this, okay? Airborne, they're saying it's not airborne. So an airborne disease like tuberculosis, not like the flu, not like Ebola. Airborne means you really need that N95 and it's really, really contagious. Now they're saying it's not airborne, which is true, but it's a droplet disease. And most people don't understand the difference. For example, flu and COVID-19 and a lot of other viral upper respiratory tract infections are droplet diseases. So technically you don't need an N95, but droplet precautions in a hospital mean a surgical mask. But again, the World Health Organization, CDC, everyone, a lot of other places are not recommending surgical mask use outside, which is silly for me because when you're in closer quarters and you're in droplet precautions in a hospital, you do wear a surgical mask. And other countries are confusing everyone because a lot of people, for example, are recommending that. For example, China is saying you're supposed to go out with a mask, period. Other countries are recommending that. But guess what? World Health Organization and CDC are not recommending that right now. They can say they're not gonna say you shouldn't do it, but they can't recommend it. As we all know, the World Health Organization, CDC, has been well behind the times. So I don't don't really buy that. I think you should wear a surgical mask when you go out if you need to travel, especially if you're doing public transport, you're doing these shopping things. I think that's important. Okay. Yeah, Marissa, I think the general public should be wearing it every single time. Jameson says that since everyone locked down, there's going to be a boom in babies. Yeah, so there may be more net population growth. And again, I think more people are going to survive the flu coming up because we're doing all the things we should have done, washing our hands, that we should have done to prevent deaths from the flu coming up. So that's one net positive. Amanda said FDA approved antibody test. It is available, but it's not FDA, it's FDA emergency authorized. Again, Henry Schein, look that up, Amanda. Henry, Schein. And then, for example, UK and other countries are using their antibody tests, but it's not well available. Like if you go into your PCP or any even hospital, you can't order it that easily right now. Like I couldn't order it in my hospital right now. So it's not available. Maybe it'll change week to week, okay? So, yeah, so there are everyone is rushing to make money on this. And again, I don't think it's going to be one company. And that's a little bit of a problem because no one's going to be standardized. The antibody test you get in California won't be the same one you get in New York, and it won't be the same one that you get in Hawaii. That's always a difference. That's like Quest Laboratories on the mainland or Diagnostic Laboratory Services in Hawaii. It's always going to be different, okay? So that's a problem. So I want to talk a little bit about PPE. Everyone knows that there's a massive problem with the N95 surgical masks. And now they're, even bandanas and scarves, and people are making these. People want to donate them. Be aware of scams. There are a lot of scams coming out of, especially China. Shocker, hashtag, that there are a lot of scams coming out of China. Unfortunately, a lot of masks are made in China officially. So how can you tell? It's hard. I mean, they even have the FDA approval letter, and that's fake. As everyone knows, and people who have gone on China know, everything is fake in China. A lot of stuff is fake in China. Not everything, but this is a sensitive time. I think a lot of people are going to get ripped off. A lot of governments are going to get ripped off. A lot of states and hospitals are going to get ripped off. The FDA and CDC has a website that shows that some of these companies that are showing fake things. There are a lot of crowdsourcing websites coming up. For example, Match.com, not Match.com, Mask-Match.com is a good donation crowdsourcing site. So if you're a healthcare practitioner and need masks, if you want to donate masks, that's the best way. Otherwise, contact your direct hospital directly. So OJ Jameson mentions, didn't see FEMA says masks because there aren't enough. Yeah. So they mentioned not having masks because they're worried everyone's going to hoard, and the hoarding is bad already. So you're right. But I think people do need to wear a mask if they're going to do something out there, ideally. I mean, the hoarding can't get worse than it is right now, in my opinion. I think it needs to make up for demand, and I think the hospitals do need to get it. Valeria asked whether a virus is spread through food. It can be spread through food, especially if someone makes your food. So I don't think delivery or takeout's a great idea if you can make it yourself. Even groceries delivery, it can be spread on the boxes. So you got to wipe that stuff down. You need a decontamination area. Obviously, don't let the takeout people in. Have them drop it off outside the door so you don't touch their hands. And ideally, you pay for it beforehand, all those things. Dogs able to carry the virus on their hairs. No, I mean, my understanding, Sarah, officially is that dogs and pets can carry it, but, not more than the normal person. I mean, if they're going out all over the place and, they're going to play everywhere and people are petting them, then I would worry about them more. But generally, my understanding is that pets generally are safe. And I'm not totally sure that's going to stay that way. They may find that maybe people are having it. But again, there's a problem. People are like, can I get it from my babies? Can I get it from anyone else that goes outside? So technically you can get it from anyone in your family that goes outside. So why not pets? I'm not totally sure, but I don't think that means you need to get rid of your dog. I just mean it thinks you have to worry about where they're going. If you're getting them out to go shopping for you at Costco, and then they come back, that's probably a bad idea. If they're really going out, you should let them run around your yard or, just walk them outside. Yeah, double OJ. Jameson said, yeah, okay, so people are recommending in LA. Again, it's changing. Every state, every city, every country is doing a different standard. The KN95, that's come up a lot. I've seen this on people that they're buying KN95 masks as opposed to N95. So again, this is meeting a need, right? This is like saying, okay, there's not enough toilet paper or hand sanitizer. Now we're gonna make toilet paper out of like, I don't know, plastic or cardboard or something that doesn't flush. Or it's like I'm making hand sanitizer out of 10% alcohol, and it's there. Do you really want it? You got to be careful, guys. I think it's better to sanitize it, and I'll get into that a little bit later. So we are learning how to reuse it, and we are getting more donations. Like China is getting is starting to donate more. Yeah, and I was just going to mention that, Marissa. So like Kraft's using their plane to procure masks from China. The New England Patriots. I hate the Patriots, but the New England Patriots brought in 1.4 million. Russia and China is sending some. Taiwan is saying a big FU to China and giving double the masks that China is donating. And that's a whole other political thing because they're not allowed to be in the World Health Organization. And I ordered some privately, and they're still stuck in shipping 2 weeks from now. And even people who are buying a lot are documenting that yeah. So Erin, you said the K95 N95 is FFP2 rated, but my friend Jameson, who knows a lot about businesses, is saying that is very, very different from NIOSH and FDA. So again, it's not to say that you cannot use it or you cannot buy it, cannot sell it. I'm just saying this is not the standard we know. Everything's changing in real time, so it's very, very difficult. So Russia donated a lot. Amanda, how long can an asymptomatic coronavirus carrier affect others? Technically 14 days is what they're saying, because then you process it clear through you. But that's a problem. You don't know if you have it. Asymptomatic people don't know they had it. If everyone locked themselves down in 14 to 17 days, then we'd be okay. But no one's doing that, as you clearly see from spring break in Miami and going to Mexico and all these awful people. So I want to go on a little bit about decontaminating. Hi, Shirin just joined. So and Erin just joined. Marissa just joined. Lauren just joined. Thanks a lot, guys. So I want to go about decontaminating. Okay, so everyone's asking, how do you decontaminate these masks? And I'll tell you, a lot of hospitals are doing it. Well, it's better than the homemade masks. I'll tell you that. Homemade's better than nothing if you're not a healthcare worker, but I wouldn't suggest that healthcare workers, first responders, especially EMT, doctors, physicians, go into wearing your own mask around patient. What they are trying to do, like people have been using everything by putting masks in Tupperware, if you've seen that, so that it doesn't get contaminated, putting them in brown paper bags. CNN did this whole article about, oh, wow, everyone is using they're using brown paper bags. This is horrible. Hey, guess what, CNN? Every freaking hospital is using brown paper bags and putting it in there and decontaminating. And so some people are using one brown paper bag per mask, obviously, and having like 3 or 4 of them and using them again, carefully lifting out. One thing that is coming out that they're showing is that, again, I talked about this a little bit yesterday. So quickly to answer Sarah, what happens after 14 days of knowing you're positive and you have no more fevers? Technically, you should be okay if you're asymptomatic. That's what they're saying from the CDC. I would give it an extra 3 to 4 days after your last fever, or after 14 days and or your last fever, whichever comes last, whichever is longer. That's what I would do personally. I mean, you could take another test again, but then you might be waiting 4 days afterwards anyway, to make sure that you don't have it. And again, I think the IgM-IgG is going to be the best test. Our test right now sucks. So Marissa asked about the Yale method. I'm going to talk about the Yale method, the N95 mask. One of the ways, and I'm not sure exactly which is Yale method, the Stanford method, where I went to school, is you bake it in an oven, these masks at 170 degrees. As you can understand, that's not very reliable, and that's not a great system because you need an oven. And how many can you put in an oven? And if you put it on metal, it will burn the integrity of the rubber bands and the mask. So you can only put it on like a wooden stand or a pizza box or something. Maybe not a pizza box, it's probably contaminated, but something like that. So it's not very reliable. The Duke method is using aerosolized hydrogen peroxide. Now again, I don't know how much that works. It's not very useful for most people to have an aerosolized room of hydrogen peroxide. Amanda, steam is not good because steam will make, like alcohol, it will make the mask wet and it will damage the integrity of the mask after a certain time. So steam is not good. There's been some theories about sunlight and UV light, but again, there are not a lot of studies showing that. I'll tell you one good, so Amanda, I wouldn't recommend shower steam. Um, there's a big company that I mentioned before that's doing a new test called Battelle, okay? Battelle is it's Ohio-based company, and they can decontaminate 10,000 masks a day. They're starting in Ohio, they're shipping to New York City, Boston, Seattle. It takes 2 to 3 days to set up, and they're gonna do about 5 centers a week, and they wanna do 100 in the country, ideally a couple to each state, especially the big states that are getting hit hard, and they can do 10,000 a day. Erin says that she thinks 1 domestic carrier is entering, exiting China a day. Okay, so that may have to do, again, shipping time, stuff being held at docks. It's really, really hard. Marissa talked about patient's room, decontaminating infection. So Marissa, I don't know about that Yale study, but if you can mention that, I think that's a great way to decontaminate hospital rooms. That would be great. Shirin said, is it possible to have more than 2 weeks of a low degree fever? It is possible, but again, if you had a negative test, either your test was false negative or you have something else. You may have something, I don't know, you could have like another viral thing. You could have a rheumatological condition. You could have something like malaria, you know? So it's very, very hard. If you have 2 weeks of unrelenting fever, and it could be a general pneumonia, like another virus or another pneumonia that is nothing like COVID-19. Sarah Grace, is it possible reinfected? Yes, Sarah, you can get reinfected. I'm going to talk about that later in my national and international update, more the international update, because people in China and Hong Kong are getting reinfected. Even if they're symptom-free, they're showing that they're infected again by nasopharyngeal PCR swab. Are they able to contaminate and be contagious still? Unclear right now. Does that mean they'll get super sick again? Unclear right now. Should you donate blood? That's another question. Yes, please donate blood if you can do it safely. We really need plasma and blood. And the blood that will be most valuable, but you're gonna have to tell them, is if you're COVID-19 recovered. Eventually, that's gonna be super valuable blood. It'll be like, go for gold market prices probably, but it's more that it'll be important for hospitals to be able to use it, and companies to get plasma and antibodies out of that. Is it sterilization or just masks or the PPE? Jameson, the sterilization process that Marissa was talking about with the Yale thing is about rooms. The sterilization for masks and other PPEs, that hydrogen peroxide thing, and the oven baking. Those are the only two that I've really seen. All the UV light, all the sunlight stuff, that's all theoretical right now. Stacy mentions that she thinks that some people are spraying their masks with Lysol. I don't think that's a good thing. You shouldn't be spraying your mask with Lysol. That will ruin it, I think, and it would irritate the lungs. I think that's a bad way. Again, the only ones I've seen evidence for are oven baking and hydrogen peroxide. And everything else, there have been theories about hanging it, hanging it to air dry, just air dry, not in the sunlight for 3 days, and maybe the virus is off. But I don't know if that's true, and where can you do that safely in your home? It's kind of hard. Stacy, yeah, they've been showing more evidence of new strains coming up, but nothing super bad that mutates really bad. Valeria, she mentioned about warm places, 26 degrees Celsius, or I think that's like what is that, like 75 degrees or so Fahrenheit or something like that more. So warm places being good. There's some theory about that. I'll get into that, but I don't think it's a deal breaker or a deal changer that only warm countries will do well and only cold countries don't do well. Because as you see, cold countries like South Korea and Japan did very well just because they tested well. And warm countries didn't all do well, that's one thing. Okay, so again, I want to go into, nurses and doctors are starting to get sick and dying. We had our first death of a nurse in New York who was protesting because she didn't get enough PPE in Jacobi Hospital in the Bronx. An ER doctor who worked and didn't have enough equipment, he died because he didn't have enough PPE. So PPE is important, and US is messing up. But we, in fairness, have the most numbers and the biggest country in terms of cases, unless you believe the China numbers are fake. Which possibly could be, very likely are fake or, fudged. So we had the first death of a nurse and a doctor, and that's really sad because of possibly not having enough PPE. And again, more than 60 doctors have died in Italy, mostly older, mostly stuff like that. I don't think they have the vaccine in China. If they did, they're testing it, but they haven't found it. Like even we're testing a vaccine in Washington, I think. Someone was already given a vaccine in Washington, or some version of it, but it's not available. So we won't have a vaccine. I guarantee you, we will not have a vaccine until next year sometime. We will not have a vaccine in 2020, okay? Lynn, I haven't heard about the ozone generator. I don't know how that works, if it's a UV thing. I don't think there's any proof yet right now. I haven't seen a standardized study, okay? Yeah, so as Jameson mentioned, numbers are definitely fake. Everyone knows everything out of China is fake. I will go into some evidence about why. They have a lot of urns. They're buying cremation urns, and there's like 21 million less cell phone users. So obviously the China numbers are very fake. Stacy, yes, healthcare workers, there's a thought that a lot of healthcare workers like this nurse and doctor got sick because what? We are in the face of people we're intubating people, and people are coughing on us, and we don't have the mask, so we're getting a higher viral load, right? It's like HIV. If you have a higher viral load of HIV, what happens? You're a lot sicker. You have lower CD4 count. You're really screwed. So I 100%, I mean, I have no evidence, but the thought is that a higher viral load make you sicker, more likely to die. So that's why doctors, EMTs, police, NYPD, all these people are getting sicker. The Italian doctors, 60 died in Italy. I don't want that to happen in America because I don't want a chance of me being one of those 60 or whatever. Yeah. So again, Amanda, the number in China is pretty low. They're saying something like 80,000 cases they only have and only like 5,000 deaths or something. That's absolute garbage. And I have to go look into that later, but it's absolute garbage that China has released those numbers. They just didn't want it to look bad. So we will never know because the Chinese deaths were cremated right away. You couldn't say goodbye. You didn't have any funerals. They're all cremated right away. So China numbers, I don't believe at all, at all. So Marissa, some hospitals are using those plexiglass boxes and some of those ponchos, but that's not standard of care. Like we should have a lot of that double gowning, the double the goggles, 2 shoe covers, whatever. I don't know a single hospital that's doing that. I don't know a single hospital outside maybe New York that is doing that because we don't have the equipment. We don't have enough of that. So it's really, really horrible. So again, I'll tell you, some nurses and doctors are complaining about some of this stuff, okay? They're complaining about these lack of PPE and the bad numbers. And guess what? They're getting fired. They're getting gag orders and emails and having masks taken off and being told, even maybe I'll be told at some point to not talk about it. I'm not mentioning specifics, but doctors are being fired. They're getting cuts to their benefits and pay. Because especially if they're non-COVID-19 essential. I understand that because some doctors work for a hospital and again, like gastroenterologists or even cardiologists or like plastic surgeons or orthopedic surgeons, they don't have any business because they can't do elective surgery. So they're basically getting laid off and fired. Think about that, They have families to feed too. I know some of you may not feel bad about that, but these are the nurses too that work for them. They're all getting fired and laid off and furloughed at least for now. Because they're no longer needed right now. Only people, I'm more of a first responder doctor. I'm a hospital doctor, so I won't get fired, I think, and I will have a lot of work coming up, obviously. So I really think there needs to be some hazard pay coming up, and hazard pay meaning like hazard pay or some way to help support the doctors and nurses. For example, your typical nurse will probably make more than $75,000, and that means they don't get any of that stimulus at all the stimulus. So your average nurse, average doctor will get zero in help, which you say, well, maybe they made a lot of money or more money than most Americans, but I mean, they still have families to feed and mortgages to pay and other different things, so it's a little tough. So again, about the mask, I really don't like the World Health Organization and CDC and FDA. Again, they're saying that you don't need surgical masks to go out. But again, other countries and other states and other cities like LA and China and everyone else, like the Czech Republic, for example, you have to go out with a mask. You have to. China, they're recommending it like you have to generally. I think, Jameson can tell me more about that. And I think, but they're saying no N95s are really needed. And for example, the FDA is saying they won't object if you wear it in the hospital and in public anymore. This is not good enough. The only reason they are saying don't use it is they're worried that then everyone needs it in America. And guess what? America doesn't have enough. So they're, because once they say it, it's policy. And anyone that doesn't offer it to them, like other work, like your Costco workers or your Walmart workers or any workers, if they're not offered it, then they don't have to work because they are put in danger. So that's why the CDC and the FDA specifically are not saying do it. And the World Health Organization is not saying do it because guess what? In other countries, they can't provide. There's not enough masks for the world. Forget about, America. There's not enough masks. And that's why the World Health Organization and the CDC in the US and the FDA are not saying surgical masks. It's not because they don't believe it would help. Of course it would help. It's logical if it's a droplet disease, if COVID-19 is a droplet disease, and everyone's, or 50% of cases or more are asymptomatic. Iceland found that out. They've tested a lot of their population. They've tested 5% of their population. They think generally 50% of people with COVID-19 are asymptomatic. And if that's the case, then you want all your asymptomatic people, in other words, 50% of the population should be wearing their mask. How do you know? You don't know who they are, so everyone should be wearing a mask. The World Health Organization, the CDC, and the FDA are only not saying it. This is not a conspiracy. They're only not saying it because then it has to, if they did it, it would have to be rule of law for all the businesses. And people would say, I'm not going to work without a mask. And you can't get the mask in time. And everything, the entire world would shut down then. So that's why. So yeah, Valeria, Ukraine. So Ukraine, for example, China, Czech Republic, certain cities, LA, whatever, they're maybe not fining, but they're recommending for masks. So that's good. I think countries should do that. And if you don't have it, don't go out. I mean, it's that simple. But, again, US is trying to do human rights and, freedom and all this other stuff, So, okay. So again, doctors are learning how to make masks, nurses too. It's very confusing for everybody. And again, doctors are living in their garages and in separate rooms and quarantining themselves when they come home. Nurses are doing that too because we're all worried about giving it to anyone. Again, I'm single, I live alone, so it's very easy for me to do that. I have a second bedroom and a second bathroom I can use just for decontamination. And that's only just so I don't spread it back to myself or something, not worrying about anyone else. So again, worry a little bit about third-party masks, do the research, but buyer beware, If you get these N95s or KN95s, make sure they are legit, make sure that you know what you're getting. And again, a lot of the markup is really bad. I've heard about $7 a mask, $8 a mask. Right now, it's very hard to find less than $4 a mask for N95. I'm sure all of you know. Holy crap, Brian is positive. My friend Brian is positive for COVID-19. I just found that out on Facebook Live. Brian, I'm real sorry. Again, Brian, if you remember earlier, he was the oral pharyngeal test that took, 11 or 12 days. So now Brian's got to essentially self-quarantine. Unfortunately, the people who are in touch with him are going to have to know and get tested too. So I officially know one of my best friends who's positive, and he was run down and really, really rough. So he is positive, and he got diagnosed with pneumonia, by the way. I hope it's okay if I say that, Brian. He got some imaging and showed that. So again, it's very similar to me, but my test was negative, but I got my test a month after my symptoms. And I only got my chest x-ray CT scan. So I believe there's a decent chance I was also positive, but I don't have the proof. In February, Brian has the proof. He had 8 days. And Wesley also said he is positive. And again, if you're getting 7 to 8 days, you're positive for you to get a test. That's ridiculous. That doesn't help you change. Another thing I want to recommend and tell you, now all these numbers we're seeing, these are 14 days in the past, okay? This is what happened 14 days ago, or 10 to 14 days. It's like looking at a wave that hit you while you're surfing, to use a surfing analogy, and you're not looking at that longer, bigger wave coming up, a setback, You're not looking at that. That's the wave that will hit you 14 days from now. But the wave we're hitting right now, all our numbers, all these infections are from 14 days ago again, when Brian and Wesley may have contracted this illness and started to be more infected. And Brian, I forget when your symptoms started, but I think they started about 10 to 14 days ago, is what I remember is about 14 days ago. So this is proof. This is living proof that an 8-day test turnaround with a 6 day of symptoms and getting whatever, that's 2 weeks ago. That's 14 days. So all these tests that are coming back positive right now are from 14 days ago, before most of us were ever social distancing. Again, I did 20 days of social distancing right now, so I've been doing it for about 3 weeks, but not everyone has done it. Wesley, we're not seeing the new tests at our hospital yet. Okay, so I want to talk about splitting ventilators too. Everyone wants to talk about splitting ventilators. Yeah, we can do it, but it wasn't. Okay, so Brian, that was like 17 days ago, he says he got symptoms. 17 days ago. LV, when will they be testing for antibodies? I mentioned that. I'm not sure. They say the tests are out, but nobody in Hawaii has it. Nobody that I know has been tested for their antibodies. So my guess is the hottest zones, like again, like the Italies, the New York Cities, whatever, will get that ability first because they need it first. Lauren, if you don't get an extra mask, yeah, running out with a homemade mask is better than nothing, but it's not very good. All these cotton masks, whatever, are generally prevent you from touching your face maybe and your mouth and nose, but it's not as good. It just isn't. I mean, you can go out. I would suggest not go out and get someone else to get the groceries and other things. If you have to, yes, you can go out with it. It's better than nothing, but it's not as good as a surgical mask. It just isn't, okay? So splitting ventilators, now FDA said possibly you're allowed to do it. Okay, Brian said 11 days ago he had symptoms, but the point is the test results now represent something from almost 2 weeks ago. That's the point, really. 11 or 14 days, whatever. So it's pretty bad in my mind, So splitting ventilators, the FDA is allowing it under emergent use. Like they're allowing hydroxychloroquine to be used, okay? So, and that's only under emergent use. It's not FDA approved. It's like emergent use, like all these companies are making tests. So they're saying if we need to, they'll allow it under emergent use, meaning that no one can be sued for using numerous ventilator or numerous, using one ventilator for numerous patients, because New York is screwed right now. They don't have enough ventilators, and it's going to get worse in New York. Like I said, it's already bad. And they're finding it's worse in the poorest neighborhoods, in Elmhurst, in Bronx, in the poorest parts of Brooklyn. That's where everyone's getting screwed. Manhattan, New York, whatever is better. So Lauren says that there's a urgent rapid testing. Okay, Lauren, check on that. Again, all the rapid testing, all the best tests, the fastest tests, all that whatever will go to the hot zones. New York City is our hot zone. As I understand it, a lot of hospitals are prepping, putting ponchos, protective equipment, plastic shields. Other hospitals are setting up their crash carts that way. Maybe even those plastic coverings. We're getting glide scopes that do easy intubations. We're doing early intubations in the emergency rooms all around the country. Everyone, if you suspect strongly someone has COVID-19 and they're starting to desat, like their oxygen levels going below 92%, and they're really huffing and puffing, you have x-ray evidence, I would intubate that patient right away, right now. Thanks, Amanda. Thanks for checking in. Again, guys, for anyone checking in, if you missed anything, this will be up on YouTube and obviously saved on Instagram and on my Facebook page, which I'll mention later. So let me go into, again, a little bit about the tests or the drugs now, because any tips on how to get our doomsday direct? So couldn't talk about your real elephant in the room. Jameson, I don't know what you mean by elephant in a room. My real expertise, I'm not sure what you're talking about. So when you talk about what you stock up on, I think that's what he means, doomsday. No, condoms. Yeah, no, you don't need to stock up on condoms. You can, it depends how much you use condoms, I guess, or maybe some of you are not using them. Again, what I would stock up on are, again, the Tylenol or ibuprofen. Again, ibuprofen now is officially re-allowed. The FDA messed up on that too, and the CDC messed up on that too, but ibuprofen would be okay. I personally like Tylenol better. It's better for your stomach, and it's better for your kidneys. The Coldy, zinc gluconate, Hall's menthol lozenges, guaifenesin DM for cough suppression, the extended release ones, 1200/60. Those are the best ones to get, the 12-hour big horse tablets, and like a vitamin C or multivitamin. Those are the only like 5 things I would really stock for over-the-counter drugs. That's me. And again, as I mentioned, for treatment, once you hospitalize a patient, there's not a lot to do for them, You do the normal things. You give them oxygen. You try to prevent aerosolizing procedures. You try not to do nebulizer treatments for albuterol. You try not to use BiPAP, or don't do it at all. You do early intubation, and you use fluids, but you don't overload them with IV fluids. Once you ventilate them and you do this early, You have to do other weird things. You can prone them. Prone them means you lie them on their face while they're ventilated and adjust things like their pressures and stuff. But I'll tell you, the numbers coming out are really bad for mortality, okay? The mortality rates are really bad once you get ventilated. We're seeing once you are on a ventilator, anywhere from 50 to Governor Cuomo in New York said 80% of people are dying once they're on the ventilator. So getting on a ventilator is not a great sign, you know? And it's even worse if your heart stops. If your heart stops, there's a high chance of dying. So someone, you know, once we start running out of ventilator, yeah, Lauren also mentioned, yeah, so vitamin C, vitamin D is important. So getting your share of sunshine and getting out, I think that's important. Even if you just do that, you don't need it through a multivitamin. But having vitamin C, vitamin D, I don't think there's a problem. If you overload on it, you know, you'll pee it out generally. You don't need to take tons and tons and tons of it, but you need your daily allowance. You get that through a glass of OJ or a multivitamin or a gummy or, you know, yeah, getting you know, vitamin D, sun on your skin, glass of milk, stuff like that. So again, the other trial, let's talk about more about the real drugs. Hydroxychloroquine and azithromycin, they're still investigating it. I talked about the Solidarity trial. Solidarity trial by the World Health Organization is looking at hydroxychloroquine and azithromycin, number one. Number two is remdesivir. Number three, that's a drug by Gilead, an antiretroviral. Number three is lopinavir/ritonavir. And number four is lopinavir/ritonavir and interferon beta. Now, the last three are really hard to find and very expensive. Most hospitals are only ever going to get resources early on to hydroxychloroquine and azithromycin. And that's only for hospitalized patients, you know? And you can sign up your patient to be part of the study. But the problem with this is I think a lot of patients are not going to want to sign up if they don't get the chance of getting a drug. Every patient's going to want, or every patient's family going to want them to get a chance to get this drug. The evidence for hydroxychloroquine and azithromycin is very bad generally. It's not that great. Small studies of 40 to 80 people. Sarah, yeah, azithromycin, so Z-Pak is used a lot for your general upper respiratory tract infection, but not hydroxychloroquine. The only people who normally use hydroxychloroquine or Plaquenil are lupus patients and people who have lupus and rheumatoid arthritis, generally rheumatoid inflammatory condition. So I have friends who have that and they have lots of hydroxychloroquine. And again, the risk of taking it is not that bad. If you only use it for 5 days, which is the recommended COVID-19 course, a lot of the things with like, you know, retinal problems and sight problems and other things are probably not going to happen. I mean, they could happen, especially usually with azithromycin, but there's a lot of, so the in vivo, the life evidence for it is not great, but it works well in lab to kill or lower the virus. So we'll see if it works or not, okay? Wesley say doxycycline. Yeah, again, so Lauren, so insurance companies are not approving it for just normal use. The only person that should be using hydroxychloroquine and azithromycin is in the hospital. If you are in the hospital and hospitalized with oxygen, in other words, a moderate to severe patient, then we can, as doctors, can use it for you. And in that case, I think it would be covered. But generally, your average person cannot go out and just buy it unless you have lupus and rheumatoid arthritis or something like that, then it would be covered. You can't just get it covered, even if a doctor wrote it for you, which they really shouldn't be writing it for you. You're gonna pay out of pocket. Now, again, it's not that expensive. That's the thing, and it's easy to make, but they're so behind on it. They gotta churn out millions of these. I think Bayer is the one that makes the generic version of it, so we gotta wait for it. Please don't hoard it, that's my point. There's also not a lot of evidence for Kaletra, for Tamiflu. There's not a lot of evidence for any of the other meds, Remdesivir from Gilead, Kevzara by Regeneron, Astemra by Roche, and Favipiravir by Fujifilm in Japan. These are all antiretrovirals. There's no evidence for them yet. They're being kind of studied right now. Again, I talked last week about the interesting data on BCG. That's the TB medicine, the shot. When you get the shot in other countries to prevent against tuberculosis, a lot of people have the shot in like other Eastern European countries and even in Asia. You may have seen a lot of people from China have it. And certain studies are showing that some people in those countries have a lot less COVID-19. But again, it's not absolute. So they are studying this again in Australia, Netherlands, UK, and Germany. They're studying whether the BCG vaccine can help prevent it. How does it prevent it? The thought is it revs up your immune system and you're less likely to get upper respiratory tract infections and maybe less likely to get COVID-19. There's zero evidence on this though. So even if you're in America, you cannot go to your PCP and get a BCG vaccine. We don't have it. It's very hard to find. We just don't have it. And you can't buy it in Walgreens or Dwayne Reed or Long's Drugs or something. You cannot get it. But it's an interesting a thought. They are studying that too. So what's the only way you can prevent it? And is for now social distancing until the vaccine. Nothing has changed. And again, we're going to get it for like a year from now. So you may have to do some level of social distancing for a whole year, I think. Generally, everyone wants to know also when we think we're going to be able to travel. I don't think we're going to be able to travel as Americans internationally for a long time, maybe until the fall, maybe until September is what I think. Because right now, every country is banning the US. Japan has banned 73 countries. Most countries have banned the US from coming there. And even if you go to these countries once the restrictions are released, you're going to be quarantined for 14 days. So all of you that want to go see Santorini and go back to Italy and go, on your trips, if you're American, you're going to wait a while. I don't think you're going to get on a plane, an international plane, for months. I mean months as until the end of the summer. I think the domestic planes are still going to be able to do stuff here or there until they might shut some of those down too. I think they may shut some of the planes down going out of New York and certain hot zones or into and out of New York. They may do that. I don't know. It depends how bad things get. There is some evidence that I don't think we're going to do that. But I think internationally, I don't think Americans are going to be able to travel. And anyone going from any other country to any other country, you're probably going to be quarantined. You're going to be quarantined for 14 days. So is it worth traveling if you're going to be quarantined for 14 days? So Wesley, we don't have any antibodies tests and antibody treatment yet that are easily available in the US. So they are using some studies. That's another study, another potential drug, IVIG. What is IVIG? IVIG is you literally get plasma drawn out from COVID-19 patients who've been infected and survived, who are mild. You like get their plasma and you like centrifuge it down and you get the IG antibodies and you get a layer of it and you give them back to somebody, kind of like almost like stem cells or whatever. But as you can imagine, that's really hard to get enough of that and it's really expensive. So I don't think it's a practical long-term solution because you need a ton of people donating who are COVID-19 recovered in order to give it to somebody. I think the vaccine will still be way more available than IVIG. IVIG, I bet you like rich people are gonna get again. They're gonna find a bunch of poor people who survived, get their plasma, spin it down, and give themselves IVIG. Celebrities will be doing that, I think, right now. It won't, and again, Sarah, you cannot, my point is, you can do this, but it's not gonna be readily available. You're gonna be super, super sick, okay? Instagram, guys, it looks like my podcast is going to be ending in about 2 minutes. So if you want to pick this up, go over to my YouTube or go over to my Facebook Live for the rest of the update. Again, this is going to be the part of the update that's about just world events, okay? So the update about Hawaii, domestic in the US and internationally, because I'm already going on like an hour right now, and I try to keep this below an hour and a half, okay? So the COVID-19 numbers, first of all, there's a link in my Facebook site, okay, about overall numbers and graphs that are really good that look at the peak, the active growth rate, when each state is gonna hit our peak, and how each state is doing relative to hammer and flattening the curve. So go onto my Facebook, in the caption there, in Facebook Live and my video, and I'll put it there and I'll put it on my YouTube as well. I want you to say, don't focus on numbers. Focus on the new cases, focus on, better yet, active cases, and focus on population adjusted numbers for new cases and active cases. The cases, the states that are doing the worst right now, New York, New Jersey, Louisiana, Michigan, Georgia, and Florida, they're doing pretty bad. New York the worst, but and I think Florida, Louisiana, Michigan, Georgia are going to get slammed next week. They're going to get annihilated in the next 2 weeks, like New York, okay? And I think the states that are doing the best are Hawaii and North Dakota, South Dakota, Puerto Rico, and Guam. Valeria, Germany was doing better, but they tested a lot of people. Their mortality rate is not that good anymore. They're like 1.4, 1.5, similar to Italy right now. So I'm going to update you on all of that right now. Okay. So again, go to my Facebook. Okay. So I think, okay, so I lost all my Instagram viewers right now. So now it's just the podcast people and Facebook Live. So hopefully you can join me again on this. So again, a lot of stuff is pretty bad. So for example, I said again, 12 to 18 months of spread, I think is going to be what happens, okay? 12 to 18 months of spread with multiple spikes. Now, New York is going through their spike first, so they'll recover first, like China has recovered first. And then the rest of the states are going to get hit. They used to say that most of us are going to hit our peak, most of the states, in other words, in US, in April 15th. That is no longer the case, okay? That is no longer the case. I'm hearing now that the peak is going to come end of April, early May. So in other words, all those states that are saying you're only going to have to shelter in place at the end of April, I don't buy it. I think soon, I predict every state it's going to say we're going to have to shelter in place till end of May or middle May, at least middle May. So be prepared. They're going to extend your shelter-in-place laws till middle May because they're saying the peak is not coming mid-April anymore. The peak is coming end of April, early May, okay? So yeah, Lauren says only way is herd immunity, but it's hard to get herd immunity to beat this until we get the vaccine or until we get that IgG, IgM test, and then we know who to send out in public and who we can who we need to keep at home, the more risky older people, especially older people who haven't been exposed to it. You know, so I think we're going to have the shelter-in-place laws until the middle of May to end of May, really. And New York will be the first to relax them, I think, potentially. But the rest of the states will get hit hard. And I think it's going to be not just pandemic. This may be endemic. What does that mean? Endemic means it'll be in our society for the rest of time, until we completely kill it. Even like HIV, for example, is endemic. So it is, we will have to go out, like Lauren says, we will have to go out and we'll have to restart some of the economy when the biggest amount of states, when the hospitals have it more under control, when we have enough ventilators, when we have enough PPE, when we have enough IgM, IgG tests, when we have enough drugs at work, they're gonna have to reopen again. And then we're gonna get our secondary bump. For example, China, South Korea, Singapore, Taiwan, they're all starting to get a secondary bump right now. As all you know, the jobless claims are really bad all over the country. 10 million people are unemployed in the last 2 weeks alone. That's more than all of 2019 and all of 2018. In 2 weeks, we had more people file for unemployment than last year or in 2018. And I think a lot more people are going to be unemployed soon. And it's really bad. Like, they are having that stimulus package, but it's pretty bad. Yeah, LaShawn, Georgia governor is an idiot for thinking that you cannot get COVID-19. Lauren, yeah, I predicted this. If you look at all my past podcasts, I think the secondary bump will happen when our next flu season happens in America. The secondary bump is already happening in China and again, Taiwan and South Korea and whatever. So actually, Lauren, I think our secondary bump may not even come in October. I think it may come by the summer even. And then the tertiary bump, the third bump will come in flu season. So I think we're going to get a secondary bump even before October 2nd. But I think we'll get one in flu season as well. So let me give a little bit about the Hawaii update. We're up to 258 cases in Hawaii, 182 on Oahu. One guy died. We have our first official death. And he was a very sick guy, as far as I understand. He was a very sick guy. So he may have died anyway, but it's horrible, but we did have a death. Very few are intubated, meaning that of those 182 people on Oahu and 258 in Hawaii, only a few, I think less than 20, are in the hospital, and very few of those are on a machine. But again, as I mentioned before, we have a healthy 38-year-old Waikiki bartender. He's intubated. He had no health problems before. He's one of those people who's intubated and they can't get him off. So it's very sad. Pretty much all the hospitals have a case already. And I mean, I know that I'll be taking care of patients as soon as I go back within 2 weeks. Again, I can't give details on specifics or how they do, or if they do well, do whatever. But we're going to get that. And again, the peak is coming up. The peak is not coming up April 15th anymore for us. It may come end of April. So unfortunately, this sucks. I mean, what? It's April 2nd. We're going to have to shelter in place for another 6 weeks is what I'm telling you guys. Another 6 weeks. Get ready for another 6 weeks of social distancing and sheltering in place, honestly. I think that's what's going to happen. So we have in Hawaii mandated a 14-day quarantine when you come. They're checking people who arrive. So if you try to sneak in and visit Hawaii and spend your time here, they're calling your hotel room randomly twice. If you're not there, they'll basically ticket you. They've been ticketing everyone out in my parks in Ala Moana. All the parks are they gave 250 warnings. I think they need to give tickets right away, but they're giving warnings. And now they're saying that they don't want any people going to Maui, Big Island, the smaller islands. So again, that's for the, that's for their benefit, because some of our smaller islands like Lanai, Molokai have 0 patients. We want to keep it that way. So again, all beaches are being blocked and patrolled. I have friends, so I won't mention who they are, who are being a little ridiculous, that went to smaller beaches like Kaimana Beach, and they had police come around and said if they didn't move, they get ticketed. I'm sorry, like, I know you need a break, but if you want sun, walk around outside, get some sun that way, do other things. Now is not the time. Lay out on your lanai. I'm lucky enough. I know I have a balcony. I lay out there and sunbathe, You cannot be on the beach now in Hawaii, otherwise you get ticketed. Surfers are allowed out. Thailand Arte Japanese medicine favipiravir. Yeah, so Valeria, they're studying it, so I don't have good evidence about that. It may not be useful. They are studying it, but I don't know. It's like all our other drugs, So favipiravir is being ordered and being used, but I don't think it'll be the deal breaker. I don't think it will cure people. It may make it better a little bit once you're sick, but it's very hard to get this medicine, really. And again, I don't think it will really help you as much if you're not that sick anyway. It's only for hospitalized patients. And again, some of these medicines are really expensive. All these antiretrovirals are very, very expensive. And I don't think they work any better than hydroxychloroquine, really. There's 0 evidence for that right now. So also in Hawaii, one interesting thing, surfing is still allowed. I know in California, they're ticketing surfers. But surfers are allowed in Hawaii if you go straight to the ocean. The rule is you have to be in motion on the beach. You can be walking, and they can only ticket you up to the water line. So if you're below the water line and swimming and surfing, then you're fine. In LA, they're ticketing you if you're even stepping on the beach to go surf. So I heard people are getting $400 tickets in LA. And hikes are technically being closed, except some of the non-standard hikes, but they're super crowded is what I hear. It's very hard to stay away from people when you're hiking. So again, the testing is better in Hawaii. It's taking us 1 to 2 days now to get tests back. The nasopharyngeal viral test, not the antibody test. Again, we don't have the antibody tests easy yet. Before it was taking 5 to 7 days. Now it's only taking us 1 to 2 days. So I think Hawaii is one of the states I think will be hit last and least, really. So let's go to the U.S. update, because I'm trying, I want to move on into the U.S. The U.S., things are bad. We've got 240,000 cases. Sorry, I'm trying to turn on my air conditioning here. It's a little hot here. So U.S., we have 240,000 cases, the most in the world. We have about 5,000 deaths, 5,500 deaths. And that's less than half of Italy and Spain, okay? So Spain and Italy have about 110, 115,000 cases. So we have more cases, but we have fewer deaths is what I mean. Italy and Spain have like 10,000 deaths. So technically, there's 1 of 2 things going on. Either Italy and Spain are not testing well enough, or they're getting overloaded and people are dying more. It's one of those 2 things. So we have more cases, but our patients in US are doing better overall. Our mortality rate is about 2.4%. It will go down. I think it will go down. Again, Lauren, I think we're doing a better job at testing than Spain or Italy. Yeah. So I think we're getting a lot more tests, and there's a big backlog of tests. I think we're going to get a lot. Our mortality rate is 2.4%, and I think it's going to go down because we're going to have much more cases that are not sick in the hospital and asymptomatic. So I think we have more cases and we're doing more testing than Italy and Spain. I have nothing to back that up, but I think that's why our mortality generally looks a little better. Okay, or sorry, our numbers are way higher, and their deaths are higher than their relative to their numbers. So again, unemployment I think is really bad all over the country. I think tourism, airlines, and oil industries are decimated. Gas is less than $1 a gallon. I've heard that's pretty crazy. And again, as some of you know, if you're an American citizen and making less than $75,000, you're getting $1,200. It should be getting mailed to you soon. And small business loans are being given out, first come, first serve, $10,000 at a 0.5% interest rate for solo LLC small businesses. But you got to apply, and I heard it's supposed to start tomorrow, but a lot of businesses are not set up for that yet, from what I understand. Okay. A lot of companies are furloughing, and that means that you can get benefits and still collect unemployment, as opposed to being fired. Then you wouldn't have any benefits and you can only collect unemployment. But some companies I heard are not matching for 401k anymore, or canceling dividends, not offering 401k. I think it's kind of a tough situation. It's really bad for everybody. One thing I gotta warn about, everyone's using Zoom right now, but I heard that Zoom is getting bombed with people, and it's a security risk. People are bombing it with porn and different things. It's a Chinese company. It's like Huawei and TikTok. There's technically security risk. I mean, I personally think there's products by Microsoft and Cisco, that are more like standard and stable. Zoom is kind of like Snapchat, if like Microsoft and Google is like Facebook, Instagram, is how I look at it. So a lot of famous people are still getting, sick. Tom Hanks is recovered. As you heard, Idris Elba, Daniel Day Kim, Rand Paul, our politician, are all positive. Angela Merkel, Boris Johnson, Prince Charles. Chris Cuomo, the CNN anchor, is positive, and he's quarantining himself. So Norm says those applications are not available. Yeah, they're not going to be ready. They're supposed to be ready by tomorrow. And so I don't think they're going to be, I wouldn't count on that money and that small business loan is what I'm saying right now. The $1,200 for less than $75,000 salary, I think will come quicker, but even that may be delayed. Who knows? So Brian said Zoom is on a 90-day hold. Yeah, I don't know. Everyone's using Zoom, even people who aren't working. But I think there's a lot of problems with Zoom. I'm not using it, but I don't need to, I just FaceTime or Skype individually people, one by one, or WhatsApp video one by one. I don't do group stuff. So, I would just say you can use Zoom, but just be worried about it. Again, everyone's rushed into using this for work and stuff. But, again, do you need to use it? Like, I don't know. So going on to the rest of the nation, 39 states out of 50 have shelter-in-place laws. But I don't know why the rest of the 11 aren't doing it. It's kind of silly. They're behind the ball. As you heard, Florida finally put shelter-in-place laws yesterday. And Georgia governor just realized asymptomatic people can get it. The governor, I mean, he's kind of like, has he not been reading the news at all? Has he been living under a rock? Like, I think your normal kindergartner knows that people who aren't sick can give you COVID-19. Francis, I haven't heard about those tests, and they're letting everyone. United Biomedical is one out of a billion, I don't know, billion, but like literally tens, if not hundreds of companies are doing their own tests. I don't know the specific about those tests. So if you tell me what it is involved or what it does, then I can tell you what I think about it. But I don't know how sensitive they are. Any of these tests, I don't know how sensitive they are. So again, a lot of these new tests are coming out, being made more available, but more for the hot, zones, the New York cities, the Seattles, those whatever. Again, I really think San Francisco did a great job. They were the first to quarantine or do not quarantine, social distancing laws in effect. And, then it spread to the rest of the season. If you look at San Francisco compared to New York or any major city, they're doing pretty well. Look at their numbers and look at what's going on there. New York, New Jersey, Connecticut, I think I'm worried about them. I'm worried about, again, as I mentioned, Louisiana, Atlanta, Miami, Detroit. Watch those four cities. Louisiana, Atlanta, Miami, Detroit are going to get slammed, maybe even worse than New York. Definitely, I think Louisiana and places like Detroit, where they're poorer and not doing as well and not that healthy to begin with. Let's be honest. And again, the southern states. So I think Louisiana and Detroit are going to be disasters, really. It could be really, really bad there. Again, it's easier to do certain things on a state-by-state basis. If you're a smaller state that doesn't have a big population growth, then it's easier for you to, or big dense centers, then it's easier for you to do some of these things. Even Hawaii, we have 1 million people in all of Oahu, but we only have Honolulu, so it's easier for us to, get people to social distance in a way. Again, North Dakota, South Dakota, Wyoming, these states are doing much better as a whole, okay? So, yeah, Marissa, that's probably any of the tri-state area, New Jersey, Pennsylvania, Connecticut. Well, really not Pennsylvania, it's a little farther, but they're close. Because of all the trains and all the buses and all the cars, people are doing everything. The bridge and tunnelers, Long Island's getting hit hard because of how close it was to New York. Where did it spread from? Everyone flew into New York. All those people flew into JFK, and that's how it spread. Probably from Europe and China, maybe more Europe, I don't know. Now again, in New York City and in New York, it's pretty bad. We've got 92,000 cases in New York, and the mortality rate is 2.6%. That's getting worse. Last time I did the podcast, it was 1.4% mortality. Now it's up to 2.6%. On the plus side, New York represents fewer cases. We're down to 38% of the cases are from New York. Before it was 50%. So what does that mean? The other states are hitting their peak, or starting to not hit their peak, but they're ramping up. So a lot more of the states are cases of COVID-19 are outside the state of New York. So again, the Louisiana, Atlanta, Detroit, Miami, even LA, San Francisco, Austin, these states our cities are getting worse. So New York is still getting slammed hard. And again, the poorest neighborhoods, the poor neighborhoods in Brooklyn, Jacoby in the Bronx, Elmhurst Hospital in the Queens, they're all getting slammed. Those are going to have the biggest deaths. And that's the same thing all over America. The poorest cities will have the least healthy people, the most amount of diabetes, obesity, whatever. Those areas of Detroit and New Orleans, Miami, whatever, all going to get slammed. Yeah, so Lauren, Long Island is getting really hit hard. I feel bad. I have friends who are working in ICU, and I'm trying not to bug them because they're working very, very hard. And again, as I mentioned, unfortunately, we had a first nurse and doctor, both in New York, that got sick and died in the city. So it's a shame, but it's happening. They're paying nurse practitioners $13,000 a week to fly to New York to work. And doctors the same. They're grabbing people out of retirement. So New York, the only, the silver lining is I think New York will finish first. New York's peak won't happen, mid to end of, or end of May as much, or end of April. I think it'll happen more, middle to end of April. And then the rest of the peak for everyone else will be end of April to early May. So New York will end first too, like China ended first. So that's my prediction of New York. It's just simple logic, and we're hitting, and it's not getting a lot as worse as it is the rest of the cities. It'll get worse in America, is my understanding of how it works. So going to California, the West Coast, again, the military boats, they have the U.S. Mercy is in New York, and the U.S. I forget, Comfort, I think, is in L.A., San Diego. Those are for non-sick, non-COVID-19 patients to release the burden from the hospital so we can take care of just COVID-19 patients. And again, I talked about a lot of people not still social distancing. Personally, I think all the people all over the country should call, and try to, set up neighborhood hotlines, not call 911, but if you're seeing a massive gathering somewhere, someone should know about it. Call the normal police line, not call 911 and call them out on it. Like spring breakers are going to Mexico and coming back sick, and Miami and coming back sick. I know of all that. For example, Louisiana, yeah, Lauren, I mentioned that already. Doctors are going off without pay. And nurses are helping out without pay, but that's out of their own, good sort of heart that they're doing that. So again, Louisiana is getting hit the worst. Their mortality rate is 3.3%. Now that's better than the 4% it was before, but Louisiana rate is really, really bad. Louisiana pastors and Miami pastors are still having congregational things. That's stupid. That's really, really stupid. Again, the best states so far that I see are Hawaii. So we're doing pretty well. Nebraska, Wyoming, North Dakota, South Dakota, Montana, West Virginia, maybe a little bit of Delaware. And again, some states are needing so much help. For example, they're going to give me a free expedited New York, Pennsylvania, and Delaware license, and Iowa and Indiana, those 5 states, just to practice telemedicine there, which I may be doing by next week. So the curve hasn't really flattened. And I know all you parents know that the school year has been canceled. I would worry a little bit about the fall too. So I'm not saying it's going to get canceled, but again, we get a bad secondary or tertiary bump, a second or third bump in the fall. Be prepared that they may cancel school or, make school remote learning again for the fall. That's my prediction, because we're going to be so used to doing it by now. Your kids are going to be on homeschool, remote learning for what? For 2 months now, so it may happen again in the fall. I'm just saying, prepare for that. So again, and people say, when can we travel? The US is not going to be able to travel internationally for a while. It's level 4 warning. We are not able to do it. We cannot travel, and the other countries won't let us in. And if they do let us in, you're going to quarantine for 14 days. So what's the point of traveling anywhere if you're not going to be able to leave the hotel room for 14 days? My friend Nicola in Australia came home as an Australian citizen from England, and she was locked into a hotel room for 14 days, locked in. She wrote an article for Marie Claire, so you can Google it. Google Nicola, Nicola, Marie Claire COVID-19. Her interview's there. It's pretty scary. It's really nasty looking. And for example, in a place like Hong Kong, they're GPSing you. They're putting a bracelet on you, literally GPSing you, make sure you don't leave. So I'm not personally planning any international travel till August or maybe even September. Maybe domestic travel before, but that depends on the rules. So I'm not planning any travel, and you know how painful that is for me. Marissa wants to know if the bumps will continue to occur until we have a vaccine. Yes, Marissa, I mentioned this multiple times. It will go on till a year. Until we have the vaccine, we'll get smaller bumps, but I think we're going to have bumps. How do I know? Look at China. Look at Singapore. Look at South Korea. As we get people coming back in who are asymptomatic still, it will go on that well. It will go on with these smaller bumps. So we will continue to have bumps until 2021. We will have bumps for the rest of the year. I don't know how many more. I think we're going to have at least 2 more bumps before this year is over. One in the summer, one in the fall, the winter for flu season. And our bumps will be different from every other country's bumps, obviously, because every other country is ramping up. For example, Italy's second and third bumps will come earlier than ours, So Lauren, so medical, if they're flying in from other countries, they got to, whatever. So let me do the world update, because we're getting really long on this. The world update is there's 1 million cases in the world. That is not surprising. Again, I don't focus on the cases. I focus on active cases and deaths, and population-adjusted active cases and population-adjusted deaths. Don't look at the curve of numbers. It's always going to go up for a while as other country and state hits their peak. Look at your locale. Look at your state. And again, my links will give you a good way to look at that and when the peaks are. Again, the Olympics has been held till 2021. The Democratic primary is being pushed off till August. So again, what's going on in the world? South Africa is rising in the ranks. They're getting more and more cases. And again, is it because of hydroxychloroquine? Is it because just no one was traveling there yet? I'm not sure. Africa, I'm worried about them because they're poor. They're densely packed in some places. But they've had more success fighting infectious diseases with Ebola and dengue fever and malaria. So that's one positive for Africa. UK is getting hit hard. Remember when Italy used to have a 8% mortality rate? UK, yeah, Lauren, I agree. Every state will have different bumps. The UK is 8.6% mortality rate. That's bad. And there may be a backlog of testing like there was in Italy. Italy's rates are a lot lower. Now remember, England tried herd immunity first, right away. That was a bad move. They immediately gave that up, but it was too late. They're getting sicker now. 8.6% mortality in UK. They're doing drones. They're doing Black Mirror stuff to warn people off the street now. They're sort of copying the China model, but I think it's a little too late. So they're going to shelter in place for 3 months now. 3 months. We're only sheltering in place for some of us 6 weeks so far. So they're sheltering in place for double that already because England knows they're screwed right now. And again, they mentioned that 20,000 deaths in England would be good. I don't know if they're going to be that lucky. Germany, remember, Germany used to be doing really, really well. They had like a 0.75% mortality rate. Guess what? It's going higher. It's 1.3% now. Probably because they tested so many people so fast and that were asymptomatic and healthier. And now they're running down on the testing, and the people who are sick are starting to die more. So again, that denominator is the numerator of the mortality rate. The deaths, or a number of deaths, is getting higher. So they're not doing as well anymore. Everyone said Germany was great. They're down to 1.3% right now, you know? So actually, if you look at the mortality rate, Italy is doing better than Germany right now. They used to be 8%. Now they're less than 1%. But now I think Italy has tested a lot more, and Germany tested early and a lot earlier. So it's a really interesting thing now. Italy technically has a fewer percentages of death than Germany does in terms of mortality. The case fatality rate, the CFR, is better in Italy than Germany. Spain has 110,000 cases, 10,000 deaths. So their mortality is lower too than Germany, but but maybe they're doing worse testing. Now again, maybe Italy and Spain still haven't done enough testing, and maybe their testing will start to ramp up more. You know, it's very, very hard. Now, as you heard from my friend Valeria in Ukraine and Czechia, Czech Republic, you need to have masks when you go out. So they're not doing, they're being more strict. They don't necessarily have better statistics for death rate or case fatality rate, but they're doing better. Iceland is doing really well. They did 5% testing. They're aiming for 13%. And they're saying that about 50% of those tests, or 50% of the tests that they've tested, are infected, which in other words, that means asymptomatic people are being infected. Very, very high number, you know? So it's very, very high. So again, Mexico is also doing poorly, I think, in planning. They only have 1,378 cases. But again, maybe they didn't test at all. I don't think they tested at all that well. My friend Aaron, who lives in Mexico now and used to live in China, is saying that they are now banning gatherings greater than 50. It used to be greater than 100. Now it's less than 50. That's still too much. But unfortunately, I think your typical Mexican family is very big, probably more than 10 people in a typical Mexican family living together. So it's very, very hard. I worry about Mexico and all the other Catholic countries coming up with Easter. I think Easter is going to mess them up because they're still going to celebrate and go to mass and do things unless the government bans it or prevents it. And I don't see that happening right now. And ironically, Mexico's banning the US, and the US may want to ban Mexico from coming in, and they may throw up walls against each other for a while. So even though we don't have a real wall, Trump is kind of getting his wall because for all intents and purposes, no one wants to go into the other country, or no one wants the other country to come in. That's basically what's happening right now. And again, India only has 2,536 cases and only 55 deaths, but I think those numbers are really, really bad right now. Oh, so my friend Francis said that Colorado shows a full antibody test. I think that's great. I think that's, if I remember right, a rich ski resort executive in Telluride, Colorado, got that. And that's only because he's rich and he donated it to that area. And it's great. It'd be great if every city has that, but that's a special rich city. Again, who's getting these tests? The hot zones and the rich people. It'll be like everything. The most in need and the rich people are going to get all these tests and all these drugs first. It's unfortunate, but that's just what's going to happen. Now, South Korea, yeah, Lawrence, I'm really worried about places like Africa that are poor, the slums and favelas in Rio, the poor neighborhoods of Mexico, the really packed neighborhoods of India and Bangladesh. Those are going to get slammed. There are going to be really, really bad health crises. Again, later than America, later than Italy, later than China. China got hit first, Italy and Europe got hit second, and now we're getting hit. So we're the third canary in the coal mine globally for the rest of the world. I hope everyone's learning. South Korea, they were the best, but now their mortality rate isn't as good. They're up to 1.7%. So they're actually, they're testing a lot, but what did I say? They're having their secondary bump come back right now, both in cases and deaths. As citizens are coming back to South Korea, coming back to China, coming back to Hong Kong, coming back to Singapore, that's becoming a problem. So remember, our numbers now are a snapshot of 2 weeks ago. So it's kind of tough. So that's it. And again, China, 4% mortality rate still in China. But again, I don't believe China's numbers for 1 second. They've made up their numbers. They've 100% made up their numbers for the deaths and the cases. We know they're not true. They're having cremation urns that they're ordering by the millions, but thousands, and millions of their cell phones are not working anymore. Like 21 million cell phones aren't being used anymore. So a lot of these things are indicating that China lied about their numbers. And to give an example about how China lies about their numbers, look up Luckin Brands, Luckin Brands. They were sort of a Dunkin' Donuts competitor in China. That was Starbucks competitor in China. They made up all their financial numbers, $2 billion worth of numbers, one of the biggest scams in history right now for a retail brand. They just made up their numbers. So China makes up their numbers. They do it. And this one is government sponsored. We'll never know the true numbers in China until someone defects and shows up these numbers legitimately. So we'll never know, unfortunately. But they are reopening for business. Actually, I think China is a great place to invest right now. They are a great place to invest your money compared to the US stock market and US businesses because they're going to ramp up. They're being forced to ramp up earlier. So, and I think they'll control the second bump a lot better too. And the third bump, they will be much more in control. China will be much more in control because they can do things that no other country can do. Okay, Taiwan has the best rates again, and their businesses are recovering too. But again, they don't have the resources that the rest of the world has because they're not part of the World Health Organization because China won't allow them to be. But they are doing very well, especially with a big city like Taipei. So again, I worry about the poor countries now. India, Bangladesh. I worry about the southern hemisphere that's getting colder and getting into their flu season. All of South America, all of Africa, Australia, New Zealand. I worry about them more because they're going to get sick just from the flu. And unless they are really good about getting those vaccines out and doing other things, I think those countries are going to get hit also last and also hard if they don't do it right. The least populated areas like New Zealand or the Patagonia in Argentina and the really isolated parts of the Amazon in Brazil will not get hit as hard, obviously. That's a population density. But the Rio de Janeiro, the Buenos Aires, the all the Cape Town, South Africa's, those could get hit hard. They could get hit hard. So that's it. Again, I'm going to end there because we're going around 1 hour and a half and 90 minutes. This is getting really long again. The last inspirational stuff. I think everyone is learning new skills. That's really good. Telemedicine use is up. And people are learning to be more self-sufficient and that you don't need a lot. You don't need a lot of food. You don't need fancy restaurants. You can cook more. You don't need to buy so much stuff, both because you're saving and both because maybe you just, don't need to buy as much because you're not going out. You're not partying as much. I think that's great. People are volunteering more. The military is, coming out again. Thousands of people are volunteering their time coming out of retirement, Again, Allison, I mentioned this earlier in the podcast. The plasma therapy is great, but it's not useful for anyone in a hospital setting, unless you're in a hospital setting and very sick. It's going to be very difficult to get it. You're not going to be able to buy it over the counter, get the pharmacy, and it's going to be hard to make. It'll be a stopgap measure until the vaccine. It's not going to be very useful unless you're very, very sick and about to die. I think they're going to save it for that because it's very difficult to make. And it's saved for the sickest patients, like the sick patients in Mount Sinai Hospital. It's getting hit hard in New York City. Again, I want to tell you again, 80% of people are going to be fine. 5% will be critical, but we still have a 2 to 3% mortality rate. That's not as good as 1 point whatever international. So we got to test more and we got to keep people healthier. So we got to still self-distance and do all that. I think people are getting better with that. One thing that this whole COVID-19 thing really shows me is that people are really lonely. They are incapable of self-distancing or social distancing or self-quarantining because they're lonely. They can't be away from people. The fact that Zoom has taken off shows me that people aren't used to being alone. Like I'm very used to being alone because I'm a bachelor. I travel alone to countries, but other people are not. And sometimes you're finding that the people you should be okay with in your family are getting to annoy you a lot. So you need to treat yourself and learn to, whatever makes you feel better. If you need to talk to therapists online at Headspace, or Talkspace. You know, some of these are are different things, or have your own therapist. Even if you just need to talk to a telemedicine doctor, that will help you. And telemedicine is being covered by insurance, by the way. I think it shows that people aren't able to be alone and deal with their own thoughts in silence. A lot of people are having trouble with this. And it also unfortunately shows me that a lot of people are really selfish and are hoarding, even if they don't need to for their own family, but they're getting things for themselves and their family that they don't really need. It's not just toilet paper, it's not just canned food, it's medications, it's masks. This is showing who the worst people in society are right now. I think that's also a little inspiring because you get to know like what is happening, and that, unfortunately some people, even people even some of your friends, even some of you are not acting the right way. And you have to ask yourself, why are you doing this, So again, try to have your dinner dates virtually with friends, 2 or 3 times a week, real dates with, people you're dating. Have a bubble bath if you can do that, get a massage from your partner as long as you're both not symptomatic. And again, try to keep your phone out of your bedroom and try to keep the TV off. Limit TV and Facebook use to like 1 or 2 hours a day, like my podcast, and just turn it off after that. I think I've given you a very good overview of COVID-19 right now. Try to minimize stuff like Netflix binging and video games too much. The reason I think it's okay to spend your time, but you spend so much time indoors, you don't get any vitamin D, you don't go outside, Again, you can go outside safely if you stay away from people. The reason I don't like Netflix binging and video games is you never really stop. Stick with like movies, or like at least have a set time limit or something, Oh, by the way, so I'm going to end with that. I'd love all of you to check out my new webpage at thetravelingdr.com. I set it up. It's a new website. I'm going to start doing telemedicine consults in the state of Hawaii, but maybe even New York, Pennsylvania, Delaware, Iowa, and Indiana, wherever they'll credential me. I may be able to do telemedicine in like 6 states starting next week. And the link to that place and me doing telemedicine will be on my website, thetravelingdr.com. Thetravelingdr.com. You can also follow me again on my Facebook at The Traveling DR, or just look for The Traveling Doctor. Instagram at The Traveling_MD, and Twitter is at The Traveling DR. I'm still learning how to use Twitter. It's not that easy for me. And I have, again, all these podcasts will be on YouTube. You can search The Traveling Doctor. I'll have old podcasts there. I'll have a podcast on Radio Public, also at The Traveling Doctor. You can look for me there. And again, I'll be sending out the link again on Instagram and on Twitter. It's public. You can share it. I've got some good graphs that are on my caption to look at graphs if you want to look at COVID-19 graphs. The ones I posted up are the best one. The first link for country case mortality, number of cases in each country, number of mortality in each country. The second graph is a really good comparison for the state and the country and how we're doing it, states within the country, at slowing our curve or flattening the curve. The last one is about when we're going to hit our peak. The last graph, when each state is going to hit our peak, okay? So that's it. And yeah, hopefully you guys found this useful. Thank you all, Lauren, Allison, Francis, Marissa, Valeria, everyone who's listening at home and on my podcast and on YouTube and anywhere else you're listening. And feel free to forward this. Again, I will be doing these from now on Monday and Thursday, 1 p.m. Hawaii Standard Time. Again, Monday and Thursday, 1 p.m. Hawaii Standard Time. I may add another one on for any of my other friends. If a lot of news comes out or there's something really big, then I might add on another one. I'll let you know on Instagram, on Twitter, on Facebook that a podcast is coming up. And again, I'll make them savable and shareable and public, okay? So thank you guys. Thanks for checking in. And this is The Traveling Doctor saying peace out. Stay safe, wash your hands, social distance, and aloha, okay? I'll see you guys on Monday.